Hello everyone, myself Dr. Manjeet Kumar, Faculty of Paramedical Science, Department of Physiotherapy, Rama University, Kanpur. So today I am going to discuss about the what is the motor neuron disease. Actually, it is a very complicated disease or disorder which are found in human beings. Usually, it is a rare disease which is found, but almost still it is the very critical conditions. So, it is important to focus like this conditions is very important and necessary. So, what we will be talking about in this video, that is what is the MND, what is its etiology and risk factors, along with clinical features, and then how to investigate it, and later on we will discuss how to diagnose and management, and ultimately it will be ends in the outlook. So as we found in the society, this disease is a rare, and it's a kind of neurodegenerative disease. Neurodegenerative disorders are very means having incidence more and more. So in these conditions we found the numerous clinical features like here patient may feel pain, discomfort and muscular weakness. That's why their functionality will be reduced, and there is most commonly problem in the breathing. So these are the clinical sign and symptoms for motor neuron disease. Actually, this neuron disease is what is called, why it is called as motor neuron disease, because this is the involvement of the upper motor neuron, sometimes lower motor neuron, or even both type of motor neurons. So what is the etiology? When we talking about the etiology, it is mostly seen that it is conditions which involves the genetic factors, and also sporadic causes are there, which is very occasional. So when we discuss about the genetic factors, these cannot be identified easily, and when we going through the others regions that is sporadic, that may be or could be even environmental factor, some toxins, viral infections. These are the some factors. On the basis of that we can some takes idea about the motor neuron disease. Otherwise, any standard criteria to rule out this disease is not there. So we will discuss about the stages of this disease. So there are the three stages. First one we can say early sign and symptoms. Second disease is we can say mild, and last one is the advanced form of this disease. In these stages, in first where there is early sign and symptoms, here is most commonly finding are breathing difficulties and muscular weakness and drooling. These are mostly findings which are found, but in initial stage, means in first stage, these are very mild, and second or means middle stage, they are more severe than before, means earlier conditions, and in advanced cases these are actually all features, all conditions are very severe. So very severe form is the third stage of these conditions. So next we will be talk about the risk factors. What are the risk factor? Actually, risk factor are those factor or determinants which will lead to finally cause of the disease. So as we already discussed about the causes, so we can already takes idea and about the risk factors. So risk factor of disease are, as already explains, means they are sporadic conditions or they may be inherited conditions like this. So next one is investigations. So these conditions we want to diagnose. To diagnose these conditions, we have to follow some criteria. We go through the investigations, in which first one we go through blood test. Why blood test? Because as we know, in these conditions there is a weakness, muscle weakness due to break of muscle fibers. When muscle fiber breaks, there is a deficiency of creatine kinase. So these enzyme could be found in the blood. That's why we will go through the blood investigations and we go through the MRI. But MRI actually directly not related to these conditions or motor neuron disease, because we cannot find stage or conditions, we cannot show this upper motor neuron status in the MRI. But why MRI is important? Because it can rule out the other conditions. So it is helpful. Other conditions we can rule out one by one, we can eliminate it. So finally, if we found nothing, means there is some chance of the motor neuron disease is present. So in this basis, we can some take idea about the diagnosis of motor neuron disease. Next is, what is the management? How motor neuron disease we can manage? So before this, we want to some outlook over the types of motor neuron disease. Motor neuron disease, most common form of ALS, amyotrophic lateral sclerosis, which is mostly found 60 to 70%. And as a common form, motor neuron disease mostly affected the men greater than women. And when considered about the genetic situations, then 10% of total MNDs are hereditary, as we take idea from the USA. So these are the some idea, and another one is primary lateral sclerosis, second categories. Third one is progressive spinobulbar muscular atrophy, and next one is spinomuscular atrophy, and here is progressive muscular atrophy, and also Kennedy's disease is also come in the categories of motor neuron disease. And motor neuron disease also called as Lou Gehrig's disease. Why? Because as we know, the person who were the baseballer sportsmen and they died with this MNDs. That's why it is also called as Lou Gehrig's disease, that is ALS, amyotrophic lateral sclerosis. Now we talk about the how to manage. So management could be done by the three ways that are one is medicine, other is physiotherapy. These are the ways by which we can manage. Otherwise, there is no standard criteria or cure criteria to handle these conditions. So, we will talk about the medicines. Medicines, patient mostly take painkiller and he will take baclofen to reduce muscular tightness or joint stiffness, and again next management is physiotherapy. In physiotherapy management, we have to focus over the muscular weakness, and also we have to focus over the any kind of tightness, stiffness. So, for this we manage to do this, we have to do some exercises also in the form of stretching, strengthening, which will take help in the management of muscular system. And another one is we have to use to reduce the stiffness or spasticity, we can use some kind of manual therapy. And ultimately for respiratory management, if it is very critical conditions, then we have to go through the some kind of ventilator, invasive ventilator or assistive ventilator. So these are the management criteria for the motor neuron disease. And last is the what is the outlook, what is the life expectancy for this disease. So it is actually depend upon the age of the patient, onset of the age, at which age patient has suffered from this disease. So on the basis of that, we can take some idea about the outlook. That's it. Thank you.